did you have some announcement to make at the beginning?
Yes, Mr. Chair. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. The meeting is also being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. Mr. Chair, would you like me to call for the
Call
attendance?
the roll, certainly.
Okay. Graham Ritter,
Certainly.
Chair.
Yes, here.
Pavel Arasek. Paul Philpott. Shelley Sweet.
Here.
Thank you. Christopher McKiernan.
Here.
Thank you. Matthew Katz.
Here. Can you hear me?
Thank you. We can hear
Yep.
you, Mr. Katz.
Yep.
Trusha Dave, subject matter expert, Connecticut Insurance Department.
I'm here. Can you hear me?
Yes, we can hear you.
I'm
Thank
here.
you, Mr. Thank you.
Okay, excellent. Thank you.
Okay.
And I think at this point, members of the senior leadership team will introduce themselves.
This is John Carbone, Director of Small Group Product Development and Broker Support.
Hi, everybody. Susan Rich By, Director of Legal and Governmental Affairs, Access Health Connecticut.
I think we're good to go right now, Martin.
Okay. And Mr. Chair, we did not receive any public comments.
Okay, no public comments, so we'll move on. Could I hear a motion to approve the minutes from our last meeting, which was in
So
August?
moved. This is Matt. So moved.
Okay, thank you. Second?
Second.
Matthew, could you second? Chris, somebody?
I don't know if I can second if I first it.
Mr. Katz made a motion, and I think Ms. Sweet
Oh, I'm sorry,
seconded the
misunderstood.
motion.
Okay,
Is that
it's been
correct?
done then. All right, I got it back.
Okay.
Okay,
Thank you.
discussion, questions, comments, edits? Okay, hearing none. Could we have a roll,
Look
a
good to
vote
me.
on the approval of the minutes?
Graham Ritter,
Yes,
Pavel Arasek, Paul Philpott, Shelley Sweet.
Yes.
Thank you. Christopher McKiernan.
Yes.
Thank you. And Matthew Katz.
Yes.
Thank you. Motion passes.
okay, thank you. Motion approved, minutes approved. Now I can turn it over to John Carbone to give us an update on the Business Plus.
Thank you, Grant. Good afternoon, everybody. Hope everybody's doing well. John Carbone, Director of Small Group Product Development and Broker Support. As many of you know, over the past 6 to 7 months, we have launched our Business Plus platform. We focused on the activities of making our small business community, especially our non-for-profits, aware of the platform and educating all our brokers and our employers about what ICHRA is, Individual Coverage Health Reimbursement Arrangements. Our effort has been super focused on the engagement through the brokers, having one-on-one discussions and in-person trainings, making sure we're giving all our brokers and our employers clear resources and information about what ICHRA is, how they can tailor it, how they can make it fit into their budgets, and how it can help their employers and employees going forward. It's been along the way, we've navigated several challenges, most notable the significant reduction in the broker commissions. As many of you know, the individual market has kind of drastically changed their commission structure. Molina has gone away from commissions and paying a $1 commission for new business, still paying their $18 for renewal business on the individual side, and Anthem has reduced their commissions down to $10, from $18 down to $10, up to 2 times max on that. So that has dramatically kind of changed the commission structure and has changed a little bit and slowed the adoption and the impact of what we're hoping to do with ICHRA and the momentum going forward. Martin, next slide, please. There we go. So this is our Business Plus and our ICHRA workflow. As you can kind of see, we're working through our employers and brokers, and then our employee enrollment, carrier effectuation, the billing, and ongoing changes that we have to do with our platform. For our brokers and our employers, we've stayed super focused on engaging them and educating them on the process. We understood this is a very complex product and a complex story that we have to deliver to the broker community and deliver out to the employer. But as we've kind of gone through it, we've noticed that we've been gaining traction and momentum on kind of slowing things down and explaining all the different types of strategies. And this month in January, we've started seeing some good traction on the adoption of this with some of our groups and our employers on understanding how this can be an incredible resource to a potential group that may have significant issues on either providing health insurance or making it available to their employees and using our Business Plus platform. So our main goal is identifying all the employers are out there that would be interested in it. Again, we were super focused on first time around with our non-for-profits doing about 7,000 plus mailers multiple times out to them, setting up one-on-one meetings with them as they come into our platform, expressing interests, and basically starting to plant that seed moving forward. And also with our broker community doing a number of trainings, which we'll talk a little bit about going forward. But as these groups, as they start adopting or become interested in it, we kind of talk to them about the enrollment process, walking them through it, how they can go through Business Plus platform to either enroll into the individual plan with an ICHRA, an APTC, an advanced premium tax credit plan, or a small group plan if it fits or adopts into them. The great part about the platform that we've been getting a lot of good feedback is that the brokers and the employers appreciate that the platform allows them to kind of take care of the billing and payments of the system through the platform for these individual plans. So we understand that as we've kind of gone through these journeys with the carriers, we've kind of been stumbling into a few things and understanding how we have to kind of work with our carriers, Anthem and Molina, to have them understand the process. And we feel like we've been kind of those lines of communication have been opening up and it's become more of adopted on both carrier sides. So we want to thank them for that participation. So I think it's really important we talk about this because there are some things that as we develop a new platform and as we started launching it out, we knew once we started getting into the platform, we were going to, stumble through some roadblocks and we were going to have some great successes on things that we've kind of implemented that we knew that helped speed the process along. With our brokers, their main part was kind of understanding the strategies and the concepts that were out there, but there was some kind of friction about, complexity and how long it took them. We have adopted some brokers who have basically in 13 plus years, they have not written an individual plan. So they did not understand the complexity on what they had to do. We're going through identity check, income verification, and all that stuff through the platform. So they didn't understand how much time it would actually take to do it. And also too, because of some of the, new platform technology versus our individual technology platform, there were some manual interventions that our team had to get involved to make sure we push those applications through. Simple example would be someone probably 6-7 years ago may have had an account on the individual side, but they had no clue that they had that account or forgot about it. And they go to enroll through the Business Plus platform and it creates a hard stop for them. So we would have to go in and research that member and find that old account to resurrect it, and so that member would be able to enroll through ICHRA. Again, we needed to work on, having the broker provide them less surprises through the platform and all that. And that's where our team has kind of adopted in January with Franco being very hands-on, being able to go on site, be out there with our team and our outreach team, kind of helping us out through enrollments and providing that white glove service has created little less surprises for our broker community, but they appreciate how we're kind of turning around and giving their employers kind of fast, quick answers with our, legal team helping us out when we do get some different, concepts or strategies that we need to talk about. So we understand the things that we need to put in place for brokers, more checklists, more one-on-one meetings, and a stronger track of getting our enrollments through the first time in a shorter amount of time. Our employees pretty much almost had the same thing. They're looking for a tighter timeline. They're looking for a shorter, time that their employees either have to be off the floor or not working to go through this enrollment process. And we as a team with our TMO team, our technical management team, our organization that's going to help us out go through the process of outlining new strategies and developing new concepts through the Business Plus platform on streamlining how we do these enrollments. We're excited on some new things that we have coming up in the future, but our employers are looking for faster timelines to get things done in a simpler process. We understand that we have to improve the website. We have to reduce the back and forth with the employer and employee, making sure we can provide some clean information as fast as we can, something that's simple for them to understand when it comes to the quoting tool, the enrollments, and the outcomes afterwards. And we have some things in play in the future. Next, Martin. So with that being said, we understood and listened to our brokers and our employers. In our future, we are going to design what we hopefully call it an individual overlay for our individual product. And that will help us streamline any issues to where it'll allow the member to go through all the things they need to go through. But if we do run into a roadblock when we try to move them over into our platform, our team would be able to do it behind the scenes, and it wouldn't create any issues for that employee while they're going through the enrollments. Some of the questions we had from our brokers is that the census is too complex. It is, we need to streamline it a little bit more. Just a few days ago, we've kind of finalized a streamlined census that we're going to be presenting to everybody. It's going to create a quick quote, allowing them to do drop-down boxes and be able to fill the application and upload it in a faster manner. And also, too, in our recent release that we just did regarding the Business Plus platform, our brokers and our employers said, hey, listen, we want a simpler process to review certain types of plans. If we just want to see all the gold ones, we want to see all the silver ones, we want to see but we want to see a simpler version and look and feel of that. And we want to be able to assign members to plans once they go through the process, or allow them to be able to pick a plan a lot easier. And also, too, the workflow, reducing the chase. And that's basically the hard stops we get in the system for either multiple accounts, or we have an issue with identity checks as they go through it. So we're continuing to work on improving that process with our employers and brokers. We continue to get some great feedback from them, and we're going to continue to move forward with that. And also, too, our employers and our brokers said, we want you to give us a little more latitude on being able to upload a census and a roster and be able to kind of run that through and not have to do the least amount of manual input. So we're working on improving that process in the future and making sure that also, too, they express that at the end of the enrollment, they want a faster turnaround to be able to see kind of what their invoices would be. And we're trying to cut that time down from 3 to 4 days down to 1 to 2 days. So we've got some tasks in front of us that we're going to probably be able to update. And these are going to be the 5 things that we're going to be super focused on in the future going forward. And we're going to continue to work on that. So, Martin, next slide. I think Ben is going to come on. Before Ben comes on, I think it's important we just talk about kind of where we are right now with this. We currently have written 33 groups into our Business Plus platform, 313 members. We have out of those 313 members, we have 147 of them have gotten ICHRA, have basically elected an ICHRA plan. 166 were eligible for APTCs, and they were able to go on to the individual side through our Business Plus platform. Our goal for this month was 416 members, so we're a little bit behind schedule, but looking at all the kind of roadblocks that have been put in front of us, especially with the commissions being one of them, especially, brokers kind of understanding the different compensations from a small group to an individual. Those are things we have to stay super focused and cognizant moving forward. So before I go into Ben Caldwell from Instant Health to tell us about a little bit what we've done with media, kind of see if you have any questions that I can answer for you guys. Yes, Matt.
So the total number of participants is, you said, around 300. Is that correct?
313, correct.
313. How has the government subsidies impacted this, if at all, or is just this completely separate? I know that the subsidies are impacting everything else, but are they impacting this because it's a newer program?
Yeah.
And I noticed also you said the focus on not-for-profits, which I think is good, having run not-for-profits for 30 years. I think getting to those association kind of not-for-profit meetings would be helpful.
Absolutely. That is on our list to start doing going forward. Franco and myself are going to be attending. Franco Barrero is my client relationship manager. He's my Business Plus expert. We have, I think, 2 actual non-for-profit association. We did go to the big association event that was at the convention center here in Hartford. We were a major sponsor there, presented a table. We had some great conversations. We actually now have, Ben will talk a little bit about an outreach that we've done to non-for-profits, which just the other day in one traction in about 3 postings, we've received over 147 leads that we're currently following up with and scheduling one-on-one meetings with to go through with them. The second part of your question, which actually was the first, but did the subsidies being eliminated affect this? Yes, a little bit. It definitely did. It's played a little part into it, but unfortunately, we're going to have these roadblocks up, and we got to continue to move forward and just express to employers and brokers on how this can help their employees cut their expenses down.
Okay. Shelley, did you have a question?
I do. I apologize, John, because I know I've asked this before. I just can't remember the answers.
No,
What happens with Medicare employees and out-of-state employees? I just can't remember how they kick to the system.
So right now with our Medicare, our platform allows the employer to create a contribution strategy for a Medicare, and that individual member needs to come to the employer with the Medicare invoice, and the employer through the Business Plus platform can reimburse them for that. The out-of-state is going to work identically. We are working to figure out how we can integrate healthcare.gov into the platform. We've got to figure out a couple of different ways and concepts. We're still, Marquise Davis, who's our director of IT, and I are kind of trying to figure out how we can get that done through healthcare.gov to be able to at least put all the FFM states on it. And we do have some other interests from other state exchanges for our platform. We've talked about Maryland. We've been just recently asked to provide a demo for New Mexico in the upcoming weeks. So we're going to definitely go through that. The more networks we can build, the more people we can connect with.
Okay.
You're welcome.
Well, John, I have a question. How does this impact our small business? Are these employers that previously were a small business, or are they new, or?
No, these 33 are actually, out of the 33, 24 of them have never had coverage before.
Excellent,
So
excellent.
So they are new businesses coming through.
Yep.
There have been a handful that basically have told us, hey, we can no longer afford the small group rates. So there is going to be a little bit of cannibalism on the small group side. But we're continuing to maintain steady with those rates, and we've written over 50 groups in the small group side. Off the top of my head, I think we're a little under 2,100 members. I will validate that number for you and get that out to you. But we've written over 50 groups for 1-1 on the small group side, so our team is balancing both sides. So when we don't feel that ICHRA is an option because of the complexity for a group, we tend to maybe stray them over to the other side and start talking to them about, cafeteria section 125 plans and how they can set them up, and working with their broker to have them explain different contribution strategies.
Great.
Any other
questions?
All right, I'll turn it over to Ben Cadwell from Minson Hoke. Ben?
Thanks, Sean. Hey, everybody. Ben Cadwell, Minson Hoke, and today going to give everybody a marketing overview of some of the efforts that we've done to date around Business Plus and talk about our continued focus moving forward. So starting with this slide here, this is a glance of the advertising in the market. A core piece of our marketing campaign is paid media to continue to build awareness of Business Plus and ICHRA and drive leads in through the website. So you see some examples of some of the partners in here. We, of course, are working with some of the major publications in the business community, the business journals. We also do paid social media, Connecticut Public, News 8, News 12, The Mirror. So this is just a sample. We have additional partners, but want to make sure that we are covering all parts of the state and looking at all the publications that do hit the community that we are targeting. Some of the examples of some of the content that and creative campaign that is in market are things like print ads. We have e-newsletters. We do a lot of digital banners. We try to include sponsored content and TV and streaming radio as much as possible as well. As John alluded to, we did also have the large Nonprofit Alliance Conference sponsorship. We also are looking to do more there moving forward. So the range of media that we have in market and the partners is pretty expansive, and our targeting, as John has mentioned before, does primarily focus on the nonprofit audience. I'll stress too, beyond the paid media that's a focus on this slide, we also are working on securing additional coverage of Business Plus and Access Health through earned media with publications and media partners. We're also continuing to engage with community associations and chambers. So while this slide kind of focuses mostly on the paid media that's in market, that's just one component. Some of the other tactics that you see on here, we're continuing to create and refine other assets like direct mail that we've distributed to nonprofits throughout the state. We have social media campaigns. We are developing training videos right now, additional collaterals, brochures, guides, FAQs. We also are going to be conducting webinars coming up in the next month or two and building out lists of nonprofits and community organizations to invite to that. So and one of our main focuses, to reiterate something that John said, is just continuing to slow things down and simplify as much as possible given the complex subject matter. We can jump to the next slide. Just wanted to highlight some examples of the creative campaign in market for some of the paid media that I mentioned. We've continued to refine this as we go based on the feedback that we've heard from the broker community and from employers. The campaign, the creative that you see, does lead more with questions directed at the employer and focuses on savings possibilities when switching to ICHRA, total plan options that are available, and so the more limited from traditional fully insured, and the opportunity to have everything be managed in one platform. We have had really great engagement. John touched on this before, but we've had over 2,500 users submitting forms to learn more and speak with the Access Health team about the options that they have available to them. Over 137,000 page views on the page that we have set up on Business Plus, and 6 million impressions through the immediate campaign. And this, again, just as we mentioned last time we met back in August, our focus really has been from a targeting perspective with our marketing and paid media on the nonprofit audience, given the flexibility that a solution like ICHRA brings. We've been, with some of our key messages and communications, we highlight more flexibility with plan design, additional options that are available for employers and employees with additional choice. We've talked about cost predictability a lot, so we continue to make this a core focus of not just the media that's in market, but the content that we write, the social media, e-newsletters, and all our other communications, and we'll continue to do so. And I wanted to quickly touch on just how we're engaging with the broker community and CACs. So we have conducted several in-person trainings as well as additional virtual trainings and overviews of the broker communities that have gone very well. We've continued to distribute ongoing e-newsletters to both brokers and CACs to really push the message out about Business Plus and encourage them to bring it forward as an option. So these are trainings that have happened frequently over the past 6-7 months and will continue to do so, in addition to, as John mentioned, a lot of one-on-one time that he and team have directly with brokers to reinforce what they are learning in the trainings in a more dedicated setting. And I wanted to just kind of close out by talking a little bit about the Small Business Summit. This is our 4th year going into it. We are looking at May this year. We've had a lot of great success each year on this, a lot of great feedback from the business community and the people that come, that attend and participate. We are in the initial planning stages right now, starting to put together the agenda for the event. We've evaluated several venues throughout the state, so we're advancing there. Going through some of the other upfront steps, such as looking at speakers and panelists. As you'll see here, we have had a lot of success in dedicated panels focusing on finance for small businesses, including grants and credits and different programs that are available to business owners. Marketing and social media continues to be a very highly intended topic and panel. Also looking to make sure that we talk about AI and technology impact for small businesses, and want to continue to bring out as many vendors and partners as possible for our vendor networking session that we have towards the end of the event, which has gone really well the past few years. And we also, of course, welcome elected officials to join the conversation. We've had a lot of engagement there over the past few years too, to kind of talk about their support for the small business community. And, you know, we, of course, with this group, welcome any thoughts or feedback that anyone might have that has been able to attend in the past few years and experience the event, as we are in this planning stages right now.
So thanks, Ben. Truly appreciate that. So, you know, the reason why we wanted to bring up the Small Business Summit at this part of it is because we feel like we're at the beginning stages, and we'd like to have this committee, you know, be engaged in the process and have you be part of any kind of structure and all that. So over the next probably week or so, we're going to kind of send out, you know, what we've done last year, our last year's website to the committee. And we would like some feedback. We'd like to see, you know, do you want to be part of the process? Can you help us out with keynote speakers and maybe picking a region? Because we are going to look for key stakeholders that we want to partner up with in those communities to be able to advocate for us and bring in the small businesses. We are looking to expand it significantly without changing the footprint of our budget. This year, we're looking to try to add on about 75 more small businesses, you know, 50 to 75 more small businesses, and maybe 20 to 25, you know, vendors onto the equation. So please, we would love your input, and we will get that email out to you guys within the next 5 business days. I also want to just add one thing. This year, as we kind of talked about how the commission structure has changed in the environment and the subsidies have kind of gone away and the state-based subsidies are going to be coming in play, the Access Health team has felt it necessary that we wanted to make sure that our current consumers who didn't have a broker attached to them, we were able to, one, facilitate them out to our current broker community, but also two, we went out and we've kind of developed contracting positions for the broker community to help us out on the day-to-day business, especially during the open enrollment time, to get those individual members either onto a Connecticut plan, Molina plan, or an Anthem plan if they are not attached to a broker, and help them out. So we're excited on how that's been working, and we're going to continue to move forward with that through open enrollment. And then after that, we're going to evaluate and probably end up keeping 1 or 2 of those individual brokers on all year round to help us out through the process with either qualifying events and with the Business Plus platform. So I just wanted to bring that up before I forgot to do that. Yes, Madame.
Can you explain that a little more?
So which one?
The brokers that are helping as contract, what is, say that again?
So
I'm sorry.
basically what we've done is we've hired 7 brokers as independent contractors to help some of the call volumes that we've been getting in. They're licensed brokers. We've been helping the individual members that are not attached to brokers that need to quickly make a plan choice. We can't get them to a broker fast enough. They're on the call center, so they're helping us go through the you know, the plan decision-making process for those individual members that are coming through a call, or directing them towards Husky, or directing them back to us at Business Plus or small group. But any
Whatever the case may
opportunity
be.
we have,
Okay.
the first opportunity is to get them out to if they have the time to set up an appointment with one of our certified brokers to the community, that's where we're trying to do it. But if it's live right there at the moment, we have to address that very quickly. That's what we're doing.
Hey, Shelley,
Okay.
this was in response to both carriers deciding to reduce the amount of premiums the amount of commissions they would pay. Connecticut $1. Initially, Connecticut was $0. When we told them they couldn't do it, so they bumped it up to $1. And Anthem lowered both renewal and new commissions to about $10, $15, John, for Anthem. All right, so we figured that the broker community, the ones that are certified by us, may not be as enthusiastic as possible, as needed to be helpful to our customers. So we create this as a backup. If brokers are not available, we have our own contracted brokers to step in and by the way, and help our customers if brokers are not available out in their zip codes. And again, this was all in response to be helpful to our customers if needed. So that's where we are. That's where we ended up. And again, our biggest priority in Access Health is to lower down insurance in Connecticut, help to address health disparities. So anything we can do towards that end, we will take steps in that direction. And that's what this was.
So
That makes sense. Thank you. I appreciate the explanation. And and I think you said, John, these are people who are coming to you without a broker, right? So it's not like
Correct.
they
Without
have
a broker.
advice. We need
Yeah,
to
if they have
find
a
them
broker,
advice
they're going to
quickly
them.
and timely. Yep,
You
it
got
makes
it.
sense. Thank you. I appreciate the explanation.
Thank you. I just want to be cognizant. I understand that at 4:30, we're potentially going to be losing a quorum, so I know we've got to address that. Which means, does anybody have, I know, Matt, you have a question, but Marcin, I don't know how you want to handle that. Marcin and Susan, let me know.
I don't have a question. It was answered, so I'm
Okay.
good.
Thank you.
So we are moving towards adjournment.
Fantastic.
If there are no more questions. Mr. Chair?
Okay, can I have a motion to adjourn?
So moved.
Yeah, thanks, Matt. Second?
Second.
Okay, roll call?
Grant Rader,
Yes.
Pamela Rosick, Paul Philpott, Shelley Sweet,
Yes.
Christopher McKiernan,
Yes.
and Matthew Katz.
Yes.
Thank you.
Okay, we're adjourned. Thank you so
Thank
much.
you all.
Thank you all. Thank you.
Thanks, John.
Thanks,
Thank you.
Good
everybody.
job.
Thanks, everybody.
Bye.
Thank you.
Bye now.